Okay, so now we're talking about image medicine. If we're talking about medicine, we have to deal with two parts. First, you have to have a completely method of diagnosis. Image medicine gives us these abilities. Let us to use our own hands, our body, or our actual senses to find the disease. Diagnosis, we use the basic method like in Chinese medicine. Basically, you can look the patient's face, tongue, ear, eye, to hand to see where wrong according the basic knowledge. Second is according the smell or taste. Some disease, the patient have a special smell. You can feel this. The patient also can tell you what they feel in their tongue, mouth, what kind of taste. Another method, many diseases, especially like heart disease or lung disease, they make special noise. So you can, according what you hear, to determine what the problem is. Another method is pulse. Use your hands to touch and to know how the energy is flowing, how the blood is flowing. Also, the method is touch. You touch the patients, you know temperature, you know where hard, where soft, where something is not common, like tumor. You touch it, you know it. This is the basic method. Any doctor or any healer have to know this. But here in this image medicine seminar, we are not going to talk about this basic method. We are going to talk what is special in image medicine. In universities they don't learn, but here we learn. Here, the method of diagnosis we use this way. First is, we call it energy diagnosis. In the first level we have learned. With your hands, touch or you don't touch, you can feel around the body which organ, their energy level. Certainly even this energy diagnosis method in university, they don't learn this now. Because in university now it's changed. They use more and more knowledge, not develop your own senses. Especially when we have more and more knowledge, we like to use knowledge, to learn knowledge. We ignore to develop our own abilities. About this method like energy diagnosis, in China, one professor who was a professor of traditional Chinese medical university, he used this method in his work, but he didn't teach students. So I asked him why. Why in university the teacher doesn't teach this method, diagnosis method. They said, university is a place where we give them basic knowledge. After university, students can learn this kind of knowledge with a teacher or professor or doctor directly. Second reason is there are no meditation courses for the students. This is why many of them cannot feel at once, cannot use it at once. Even like the diagnosis method for pulse. If students don't meditate, they cannot feel it well. They can just tell the pulse, but they cannot feel how energy is flowing inside and where there are problem, blockage. Second method in the image medicine, we call it symptom diagnosis.